The electronic scalpel is an important tool in 3D sonography that enhances the clarity and accuracy of imaging by removing unwanted structures from the visualization. In fetal imaging, overlying and adjacent structures like the umbilical cord, placenta, and fetal limbs can obscure the fetal anatomy and hinder the clinician's ability to accurately assess the fetus. These structures need to be removed or minimized in order to improve the visualization of the target area. The electronic scalpel or MagiCut tool addresses this issue by allowing clinicians to remove overlying structures using 3D imaging technology. It enables the user to isolate the target anatomy with precision, making it easier to assess structures without interference from surrounding tissues. The electronic scalpel offers multidimensional cutting capabilities. It can remove unwanted structures in all three axes, X, Y, and Z, allowing for complete and accurate removal of interfering tissues. This gives clinicians better control over the image and ensures that the structure of interest is clearly visualized. The electronic scalpel is particularly valuable in imaging areas such as the fetal face, brain, heart, and limbs, where surrounding tissues often obstruct the view. By removing these obstructions, it is easier to obtain detailed, accurate images, enhancing both diagnostic accuracy and clinical decision-making.